Hey everyone, welcome back to our channel. In this video, we will review the symptoms, causes, and treatments of frontotemporal dementia and provide you with a comprehensive understanding of this disease. All right, let's get started. What is FTD? Frontotemporal dementia is a type of dementia that affects a person's behavior, language, and decision-making abilities. It is the third most common form of dementia after Alzheimer's disease and dementia with Lewy bodies, and is the leading cause of early onset dementia. The first case of frontotemporal dementia was described by a doctor named Arnold Pick in 1892. Later on, another doctor named Alois Alzheimer recognized the association of Pick bodies with the disease, and the term Pick's disease was used to describe it. However, in 1982, another doctor named Mesulam described the subtype of the disease that affected a person's ability to use language, which is now known as primary progressive aphasia. Epidemiology. According to the World Health Organization, the number of people with dementia is expected to double every 20 years, with a projected 115.4 million cases in 2050. In a study that looked at early onset dementia, which is when symptoms appear before the age of 65, frontotemporal dementia was found to be the second or third most common type of dementia in most studies. The prevalence of this disease varied between 3 to 26% in the studies. However, it is important to note that many cases of frontotemporal dementia are missed or misdiagnosed, so these numbers may actually underestimate how common the disease really is. Clinical features. Frontotemporal dementia is divided into three categories based on the type of symptoms a person has. The first category is behavioral variant frontotemporal dementia, which is characterized by changes in behavior and decision-making abilities at an early stage. The second category is non-fluent variant primary progressive aphasia, which causes difficulties with speech, grammar, and finding the right words. The third category is semantic variant primary progressive aphasia, which is a progressive disorder that affects a person's ability to understand the meaning of words. To diagnose frontotemporal dementia, doctors look for certain features in a patient, such as clinical symptoms, brain imaging, and genetic testing. As the disease progresses, the symptoms of the three categories can overlap as the damage spreads to affect more areas of the brain. Patients with end-stage disease have trouble eating, moving, and swallowing, and can develop motor deficits like Parkinsonism or motor neuron disease. Sadly, most people with frontotemporal dementia pass away about 8 years after their symptoms first appear, usually due to pneumonia or other infections. Okay, next, let's dive deeper into each of the three categories I mentioned. Behavioral variant frontotemporal dementia. The early signs of behavioral variant frontotemporal dementia can be quite noticeable. Some of the main symptoms include changes in personality, disinhibition, and apathy. Disinhibition can cause someone to act inappropriately or impulsively, like approaching strangers without respecting their personal space or engaging in reckless spending. They might even engage in criminal behavior like stealing, public urination, or hit-and-run accidents. Apathy is another common symptom which can cause someone to lose interest in hobbies, socializing, and personal hygiene. This can be mistaken for depression. They might also show a lack of empathy towards others, which can cause family and friends to feel resentful. They may also repeat certain movements or phrases and binge eat or consume more alcohol or sweets than usual. They may also struggle with tasks that require executive functioning, like planning and decision-making, although their visual-spatial skills may remain normal at first. People with this type of dementia often have little insight into their own behavior, and they may not even realize that they're acting differently. In some cases, they may also have a decreased sensitivity to pain. Although behavioral variant frontotemporal dementia is a serious disease, Some people who meet the diagnostic criteria may have a very slow disease progression that can last for decades. In some cases, their cognitive abilities may even remain fairly stable, and MRI and PET scans might appear normal. These cases are called frontotemporal dementia phenocopy. Some individuals with this condition may have an underlying psychiatric disorder like bipolar disorder, Asperger's syndrome, or factitious disease, while others may have a slower or sporadic genetic form of frontotemporal dementia. If you like this video so far and want to see more, please consider giving it a thumbs up by clicking the like button below. It really helps the video get seen by more people and lets me know that you're enjoying the content. Also, if you haven't already, please subscribe to my channel. You'll be supporting me in continuing to make great content. And lastly, please leave a comment down below and let me know your thoughts on the video. What did you like about it? Suggestions for future videos? Okay, back to the video. Primary progressive aphasia. Patients with primary progressive aphasia experience a gradual decline in their language abilities as the disease progresses. During the initial phase of the illness, language dysfunction is the main symptom, with deficits in language production, object naming, syntax, and word comprehension becoming more apparent during conversation or speech and language assessments. This decline in language skills can significantly impact a person's ability to carry out daily activities. While primary progressive aphasia is often caused by frontotemporal dementia, it can also be associated with Alzheimer's disease. However, if a person has significant visuospatial or memory impairments, Alzheimer's disease may be more likely. It's also important to note that during the early stages of the disease, a person with primary progressive aphasia should not experience significant behavioral changes, as this could indicate a different type of dementia such as behavioral variant frontotemporal dementia. Semantic variant primary progressive aphasia. Semantic dementia is a type of dementia that affects a person's ability to understand the meaning of words and recognize people and objects. This condition is caused by damage to the anterior temporal lobes and amygdala in the brain. People with semantic dementia experience word-finding difficulties, impaired comprehension, and difficulty recognizing people, places, and objects. The left temporal lobe variant mainly affects a person's language abilities, while the right temporal lobe variant causes changes in behavior. However, the left temporal lobe variant is more common than the right temporal lobe variant. People with semantic dementia have trouble understanding and using words that they don't commonly use. They might have difficulty naming objects and can develop surface dyslexia and dysgraphia, which causes them to regularize words with unusual spelling or pronunciation. Despite these language difficulties, their grammar and speech remain fluent. As the disease progresses, people with semantic dementia can develop behavioral changes such as irritability, emotional withdrawal, and changes in eating habits. They may become fixated on one particular type of food or develop depression. People with left temporal lobe variant of semantic dementia may develop visual compulsions, such as collecting brightly colored objects or solving puzzles, while people with the right temporal lobe variant may develop verbal compulsions, such as writing notes or playing word games. It is important to note that while some aspects of a person's cognitive abilities are impaired, other functions, such as visual attention, can sometimes be heightened. Non-fluent variant primary progressive aphasia. Non-fluent variant primary progressive aphasia is a type of dementia that affects a person's ability to speak and use proper grammar. People with this condition often have slow and labored speech, and they may omit or misuse grammar. They might also make inconsistent speech sound errors like inserting, deleting, substituting, transposing, or distorting words. While they may still be able to understand simpler sentences, they might have trouble understanding more complex sentences that involve intricate grammar. In the early stages of this disease, people might have mild grammatical errors when writing or taking comprehension tests. However, their ability to comprehend individual words and recognize objects remains largely intact, although they may experience mild difficulty in naming objects, particularly verbs. Interestingly, some people with this condition may still be able to write coherently despite significant deficits in their spoken language. Motor symptoms. In some cases of behavioral variant frontotemporal dementia, about 12.5% of patients might develop motor neuron disease, which affects both upper and lower motor neurons in the body. This can cause symptoms like muscle weakness, spasms, and difficulty speaking or swallowing. However, when motor neuron disease is not present, mild motor symptoms can occur in up to 40% of patients with frontotemporal dementia. Interestingly, motor neuron disease is more common in patients with behavioral variant frontotemporal dementia than in patients with other variants of the disease, like semantic variant progressive aphasia or non-fluent variant primary progressive aphasia. Another common symptom in patients with frontotemporal dementia is early Parkinsonism, which is present in up to 20% of cases. This symptom is more often seen in patients with behavioral variant frontotemporal dementia or non-fluent variant primary progressive aphasia. Behavioral changes, including difficulty with executive functioning, apathy, and impulsivity, are common in patients with frontotemporal dementia. Diagnosis. To diagnose frontotemporal dementia, doctors will typically conduct a thorough evaluation of a patient's medical history, including a discussion of any behavioral changes and family history of dementia or other related disorders. They'll also perform face-to-face interviews, neuropsychological testing, laboratory studies, and neuroimaging to determine if the symptoms match those of frontotemporal dementia. Blood tests might be done to evaluate liver and kidney function, vitamin B12 levels, and thyroid function. In atypical cases, cerebrospinal fluid analysis might be necessary. Other conditions that can mimic frontotemporal dementia should also be ruled out, such as those caused by heavy metal toxicity, drug use, inflammation, or infection. Additionally, obstructive sleep apnea and conditions that can cause slow or high CSF pressure should also be considered. Tests like beta amyloid imaging can help to rule out Alzheimer's disease, which can present with similar symptoms to frontotemporal dementia, and genetic counseling may be warranted in patients with a family history of dementia, movement disorders, or psychosis. Overall, a comprehensive evaluation is necessary to correctly diagnose frontotemporal dementia and to rule out other potential causes of dementia-like symptoms. Adult-onset psychiatric disorders. Psychiatric disorders can sometimes present with symptoms similar to frontotemporal dementia, which can make diagnosis difficult. For example, patients with frontotemporal dementia may exhibit repetitive and compulsive behaviors, which could lead to a misdiagnosis of obsessive-compulsive disorder. Apathy and emotional withdrawal could also be mistaken for depression, although patients with frontotemporal dementia usually do not experience other typical symptoms of depression and may not acknowledge feeling sad. Frontotemporal dementia can also cause delusions and euphoria, which are characteristic of bipolar disorder and schizophrenia. The behavioral variant of frontotemporal dementia is the most likely to be misdiagnosed as a psychiatric disorder, such as schizophrenia, bipolar disorder, or depression. Personality disorders like borderline, antisocial, schizoid, and schizotypal personality changes and addictive disorders are common features in patients in the early stages of behavioral variant frontotemporal dementia. In some cases, inherited frontotemporal dementia associated with certain genetic mutations can cause late-onset psychosis, which is a common feature of schizophrenia and bipolar disorder. Alzheimer's disease and other neurodegenerative diseases. Alzheimer's disease and frontotemporal dementia have some similar symptoms. Alzheimer's disease may be suggested by predominant memory and visual spatial deficits, social appropriateness, normal neurological examination, and evidence of generalized brain atrophy on imaging. Patients with both dementia with Lewy bodies and frontotemporal dementia can have executive dysfunction, Parkinsonism, and hallucinations. However, dementia with Lewy bodies patients tend to have more severe Parkinsonism, visuospatial deficits, and cognitive fluctuations compared to frontotemporal dementia patients. Imaging. As technology continues to advance, there are now several imaging methods that can help doctors diagnose frontotemporal dementia. Structural MRI and CT scans can reveal patterns of brain shrinkage. Frontotemporal dementia typically causes shrinkage in the frontal or temporal regions, and shrinkage in the frontoinsular region is especially indicative of the disease. Other imaging techniques, such as PET scans, functional MRI, and single photon emission CT scans, can also reveal reduced blood flow or decreased brain activity in these regions, which can be helpful in diagnosing frontotemporal dementia. Genetics. Many cases of frontotemporal dementia are linked to a family history of dementia. While only a small number of cases have a clear genetic link, up to 40% of cases have a family history of the disease. Mutations in specific genes are responsible for the majority of inherited cases of frontotemporal dementia. Patients with a family history of neurological disorders such as frontotemporal dementia, Alzheimer's disease, Parkinsonism, motor neuron disease, inclusion body myopathy, or late-onset psychosis should consider genetic testing. Treatment. Currently, there are no drugs approved to treat frontotemporal dementia. However, the focus of treatment is on managing behavioral symptoms. Medications, such as selective serotonin reuptake inhibitors or SSRIs, can help improve compulsive, aggressive, impulsive, and eating disorders. Low doses of atypical antipsychotics can also help manage behavioral abnormalities. However, using antipsychotics in elderly patients with dementia should be done with caution due to the increased risk of mortality from cardiac events, falls, and infections. Cholinesterase inhibitors are not effective for frontotemporal dementia and can even make behavioral abnormalities worse. Memantine is also not useful in delaying the progression of the disease. Researchers are exploring new potential therapeutic targets for frontotemporal dementia. The discovery that pathological tau protein spreads through the brain has led to the possibility of using antibodies to prevent the disease from further spreading. Other approaches being investigated include the use of inhibitors of tau aggregation, such as methylene blue derivatives and microtubule stabilizing drugs. Researchers are also developing tau vaccines to treat frontotemporal dementia. Conclusion and future directions. In conclusion, FTD is a type of dementia that affects a person's ability to communicate, control their behavior and emotions, and make decisions. It often affects people under the age of 65. It can present itself in various ways, and the symptoms can differ depending on which area of the brain is affected. Despite significant advances in our understanding of the disease, we still do not fully understand its cause or have any approved disease-modifying drugs to treat it. FTD can have a significant impact on the lives of those affected by it, and it is important to raise awareness of this disease and support those who are affected by it. If you have any questions or would like to learn more about FTD, please leave a comment below. Thanks for watching, and stay healthy, my friends.